The Road to Recovery by Francis Cordero, Amber Bernardez, Razia Udin, Elaine Vasquez. Did you know that the oral health has such a big impact on your overall health? Statistics show that the oral inflammation and disease can cause the risk of head and neck cancers, immune system complications, higher risk of heart attacks, and many other impacts on the body. The theory is that the inflammation of the oral cavity causes blood vessels to constrict, leading to less blood flow in the body. Chemical factors also induce trauma and deterioration of the tissues in the mouth. Drugs can have a long-term effect to the teeth and to the surrounding tissues in the mouth. Drug misuse can cause xerostomia, also known as dry mouth, which significantly increases the risk of tooth decay, periodontal disease, mucosal dysplasia, which is the precancerous cells into the conditions, and also tooth erosion leading to tooth loss. Addiction is one of the world's most devastating health problems. Oral health problems related to addiction require more attention by both clinicians and outside resources in order to help achieve and maintain a healthy oral cavity. Your oral health has positive effects in the recovery process. Healthcare providers worldwide deliver services for addictions, but most lack oral healthcare programs. So our goal for today's webinar is to teach the importance of how to rehabilitate the oral cavity and to educate and encourage how to maintain oral health. Next, Elaine will speak about the effects in the oral cavity.
Okay. So we may be wondering what are factors that can affect the health of our teeth. So when considering oral health, it is important to keep in mind what factors can contribute to an unhealthy oral health. The food we consume, several medications that we may take, the alcohol that we consume as well, and the habit of smoking can all play a role in the health of our teeth. Just like every part of the body, the oral cavity, our mouth, is maintained by a constant pH level of about 6.2 to 7.6. And when considering an adequate diet, we want to consume less carcinogenic food and more carcinogenic food. In other words, we want more food that prevent us from developing caries, which are tooth decays. This is an important concept to know because when we stop following a home care regimen, which we will talk about in depth later through this webinar, we allow the undisrupted bacteria, that type of bacteria that we did not get rid of by brushing, to take over our teeth. So consuming less carcinogenic food is essential for the health of our teeth, along with a home care regimen, like I mentioned before. These foods that are low in allowing the teeth to later on have caries are raw vegetables, meat, fish, poultry, beans, peas, and nuts like almonds. And as we can see in this image, these are some foods that are high in sugars and they will produce a carcinogenic environment in the oral cavity. So another factor that we can consider is medication. The saliva in the mouth actually serves as a buffer to prevent bacteria from attaching to the outer layer of our teeth on an everyday basis. Several medications have the side effect of causing dry mouth, contributing to tooth decay. When we're taking, medications, we're not, we do not only want to make sure we're keeping the mouth and body hydrated by following the inadequate home care. Dry mouth will increase the chances of erosion, a form of tooth decay that is irreversible. If you're already experiencing symptoms of dry mouth, increasing water intake, as well as alcohol-free mouth rinses like Biotene and a toothpaste that has, well, you want to avoid the ingredient of SLS, also known as sodium lauryl sulfate in the toothpaste to minimize dry mouth. So just be on the lookout for that ingredient, as you know, this will increase the dryness in the mouth and cause irritation. Another factor is smoking. And we all know that smoking can lead to lung cancer. And it's important to know that oral cancer may also develop from smoking. Tooth staining may present as well as tooth loss. And there is a delay healing process of the gums following tooth extractions because of smoking. This can also increase the chances of oral infection. Next, we'll have Amber present her slide.
Hi, I'll be speaking of drugs that contribute to the oral complications. Drug abuse has both direct and indirect consequences for one's oral health. Most complications result from direct exposure of the oral tissues during smoking, or ingestion. Some drugs that can cause oral complications are cocaine, heroin, crystal meth, alcohol, cannabis, and amphetamines. Oral symptoms associated with consumption of drugs are itchy gums, dry mouth, tooth decay such as cavities, discoloration of teeth, pain in a specific area or multiple teeth, white hairy patches on the inner cheek, lesions on the lips or tongue, black hairy tongue, fungal infections on the tongue, bad taste, constant lip and cheek biting, or bad breath. With all the information that you learned so far, how do you feel about your oral health? What are your goals? And last but not least, what are your plans to succeed on your road to recovery? If you are watching this webinar, you are truly on the road to recovery. You have already taken the first step. Addiction to drugs and alcohol is a tough battle, and making the decision to seek help isn't as easy as everyone thinks. Recovery is an ongoing process, and if you are already in a treating program, the goal is to complete your way to sobriety. If you are not in a treatment program, this webinar will provide you the proper information and oral health instructions to keep up with your oral hygiene and aesthetics. The most important factor in sobriety is avoiding the relapse. When you have the strength to avoid relapse, then you also gain the ability to properly care for oral hygiene entirely. 3 ways to avoid relapse. The first one is to avoid tempting situations. There may be situations where drug and alcohol use is a part of your criteria. These places are such bars, clubs, or even friends who use. While it may be tempting to attend these events to test your ability to stay sober, it is not a good idea to test yourself. The real test is to not attend at all. Avoid toxic friends. You may have friends whom are still using while you are working on yourself. These are not the type of friends to relate with. Although you may feel like you want to help your friends, the new goal is to put yourself first and avoid the negative influences around you. The third and last is to join a positive support system. Sobriety isn't an easy task to do alone. It is important to surround yourself with healthy and positive people to help you along the way and remind you why you made the decision to get sober. This could be family, friends, and people you meet during the group meetings. Lastly, we'll talk about dental care during rehabilitation. Do you have medical and dental insurance? If so, you can call your insurance company and locate a dental site which best fits and works for your insurance. Once you found your dental home, speak to your dentist and dental hygienist about your goals and changes you want to make for your dental care. Find out more about your health status through your dental hygienist. She will also provide, he or she, I'm sorry, will also provide oral cancer screenings, evaluations on your health of the oral cavity, and also evaluation on your medical history. So things you may not know, she may be able to help you with, and she may be able to catch on to it so that she can refer you to see your physician. If you are diagnosed with gingivitis or periodontal disease, do not get discouraged. This is common in individuals with a history of drug and alcohol abuse. You will receive the treatment you need as long as you are compliant and patient with yourself. Always remember that you must always do your part to succeed in anything you want. Keep your routine hygiene and dental care appointments. Lastly, follow all oral hygiene instructions to maintain stability whether you have gingivitis or periodontal disease. You may feel incomplete with your oral hygiene care or your oral hygiene appearance. You may want to make some changes, but you do not know how to or where to go. If this is your case, then these 6 ways to complete your new goal to healthy gums will also help you along with your healthy life. Next will be Razia.
Hi, so I'll be talking to you guys about oral hygiene instructions. Our mouth is connected to the rest of our body. So to have a healthy body, like Amber said before, we need to have healthy mouth. Oral hygiene instructions include all the processes for keeping our mouth clean and healthy. Good oral hygiene is necessary for prevention of periodontal disease, dental caries, bad breath, gingivitis. Good oral hygiene and dental care will help prevent loss of teeth. If you have completed the sobriety and want to focus on your oral health, here we'll go over some good tips on how to pursue this goal. You might be wondering, why should you follow the oral hygiene instructions you were given? As always, prevention is always better than looking for a cure. As you are working to prevent any further damage due to drug or alcohol use, creating a good oral hygiene habits will keep away most dental problems, saving you from pain and unnecessarily costly treatments. Next slide. So here are a few basic things that you could do in order to achieve good oral hygiene. You want to make sure you brush your teeth twice a day with a soft bristle brush. The brush size and shape should fit in your mouth and allow you to reach all areas easily. You want to make sure that you replace the toothbrush every 3 to 4 months or sooner if the bristles are frayed. You want to make sure you floss your teeth at least 1 time a day. And like my classmate Elaine mentioned earlier, you want to keep a proper diet. It's very important for oral hygiene. You want to incorporate rinsing with your oral care, and you want to go for your regular dental checkups. So don't miss those appointments. So here is a brief description of how to brush your teeth. As always, you want to brush using always a soft bristle toothbrush. You want to use a anti-cavity fluoride toothpaste. Over here on the side under one brushing, you can see a brief description, but you always want to ask your hygienist which brushing method they recommend for you. There are many brushing methods like the Bass or the Saucus cleaning method, Charter's method, modified Bass technique, scrub brush method, modified Stillman's method, the roll technique, Phones or circular scrub method, or physiologic or Smith method, or vertical or Leonard's method. These are various different ones, and they each serve a different purpose. Over the next few slides, I'll go over the most common ones that are found to be effective and a lot of people use. So this over here picture on the right is called the best method or the sulcus cleaning method. And it is the most acceptable and effective method for the removal of dental plaque. It is indicated for open interproximal areas, cervical areas, beneath the height of contour of enamel, exposed root surfaces. It is also recommended for patient with or without periodontal involvement. So if you just want to maintain your current health and you like it, you want to continue with this method. The advantages of this method is that it is very effective in removing plaque. It provides a good gingival stimulation and it's fairly easy to learn. The disadvantage of this method is that if you brush too harshly, it may convert very easily into short stroke, and it can turn into scrub method very easily, and it can cause injury to the gingival margin. And it is a very consuming technique. It takes time. And in certain patients, if they have dexterity issues, they may run into complication with the method because it requires high amount of dexterity. So when you are brushing with this method, you want to make sure you place the bristle along the gum line at a 45-degree angle. Bristles should contact both the tooth surface and the gum line. And you want to gently brush the outer tooth surface of two to three tooth using a vibrating back and forth rolling motion. Move brush to the next group, 2 to 3 teeth, and repeat this procedure. And you want to make sure while you switching from tooth to tooth, you want to remain the 45-degree angle bristle, contacting the tooth surfaces and the gum line, and gently brush using back and forth rolling motion on all of the tooth. And then you want to tilt the brush vertically behind the front of the on the front teeth, and you want to make sure you do several up and down stroke using the front half of the brush. And then for occlusal, which on the top surface of your tooth, you want to place the brush against the biting surfaces of the tooth, and a gentle back and forth scrubbing method can be used in this case. And then at the end, you want to brush the tongue from the back to the front in one sweeping directions. Next. So this is the modified best technique, and it is very similar to the technique that mentioned earlier. The only difference in this technique is that it has a sweeping motion from the cervical to the occlusal surface. So you kind of sweeping it out from the gum line. And this method is indicated as a routine oral hygiene measure for intracircular cleaning. And the advantage of this technique is that it is excellent for the sulcus cleaning, which is hard to reach with other methods. And it is very good for the interproximal areas, which is between your teeth. And it's very good for gingival cleaning. And it also gives a very good gingival stimulation. The disadvantage is similar to the previous method that was mentioned. It requires a good dexterity. So if you have wrist problem or any kind of joint pain or anything, you may run into complication and might not be able to perform it. So this is the modified Stillman technique. This method is also indicated for dental plaque removal from the cervical areas below the height of the contour, enamel, and exposed proximal surfaces. It cleans tooth surfaces and gives gingival massages. It is recommended for cleaning in areas that has recession, or it seems like it is progressing towards that direction, or areas that has ton of root exposure. It's very good for that. The disadvantage to this method is that it is very time consuming, and if it is not properly done, it can damage the attachment called epithelial attachment on your teeth. So if you have a lot of recessed areas, or you're going toward that direction, I definitely recommend you sit with your hygienist or your dental care provider and you demonstrate this method in front of them, and then whatever correction they have to make for you, they'll do it right there. And it's good to make sure that you're doing this method correctly. This technique is basically your bristles are pointed apically with the oblique angle to the long axis of the tooth. The bristles are positioned partly on the cervical aspect of the tooth and partly on the adjacent gingiva. The bristles are activated with short back and forth motion and simultaneously in the coronal direction. It is recommended that you do 20 strokes, and the procedures is repeated systematically on adjacent tooth. So you want to go in order and do 20 strokes. Either you start from the back and go to the front, or front to the back. Next slide. Okay, this is the phone method, or the circular, known as phone, circular, or the scrub method. This method is usually indicated for children, but it's great for patient or people who are physically or emotionally handicapped, or patient who lack dexterity. All those previous method mentioned above, it requires a lot of movement of the hand. So if you are struggling with that, this method will be very good for you. So when you're doing this method, you want to stretch your arms out and you want to make sure that it's parallel to the floor. Then you want to draw a big circle using your whole arm and bring it to your mouth. Once you're in front of your teeth, you want to make circles in the teeth with the toothbrush, making sure that you get all the gums in the teeth. The advantage of this technique that is very easy to learn and the time requirement is very short. The disadvantage is that it can cause possible trauma to the gingiva, interdental areas, and if not properly cleaned. And it is detrimental for adults to follow properly, especially if they go too rigorously, they can abrade a lot of the tissue away. So again, like I said before, you want to consult your hygienist or your dental care provider, and you want to demonstrate this. When they show you, you want to demonstrate it to them. Next slide. So now we are going to go over the flossing. So when you're flossing, you want to make sure you take out a 18-inch floss and wrap it around one finger, and then take a small amount at a time. And you want to make sure that you don't you don't use the same piece on one to the other. You want to change it because you could carry the plaque from one tooth and introduce it to the area that it might not have it. So that's why it's important to form a C and wrap it around your teeth and go up and down. And like I said, a new area of floss should be introduced in each area of the gingival pocket. And you want to get this all of your teeth. And it is very important to floss because what floss does is disrupt the biofilm accumulation, and it prevents plaque from forming behind the teeth, or the plaque that you are unable to brush away. So the floss will help you get rid of it. And the floss also helps prevent periodontal disease by removing the plaque. Next. So a lot of the time people come to clinic or they're complaining about malodor or some about that they want fresh breath. So it's very important to include a rinsing material with your daily care. So I know a lot of us are here over here trying to recover from an addiction, and um, it's very important that you want to use a product that will not get you to relapse. So you want to talk to your healthcare provider. You want to make sure if you have alcohol addiction or you are recovering from it, you want to make sure it's a product that's alcohol free. You want to follow their recommended guidelines, and you do want to get the recommendation from your oral healthcare. You want to use that daily. It will help with the dryness in the mouth, and it will keep a healthy, fresh breath. And also make sure you get something that has fluoride in it, which can help boost the strength of your teeth. And always make sure to follow the manufacturer's instructions when doing it. And if you have any question, please ask your healthcare providers, or we'll include our information email below so you can ask us, email us. Thank you.
On behalf of Plaza College, myself, and my classmates, we would like to thank you for taking time out of your busy day to review this webinar. We hope that this influences you and helps you on your recovery journey. Thank you.